I see in doctors' notes pretty often, like, transfuse once we hit that trigger of 7.
Right.
So how do you feel about that? Is that what we should do? Just go by 7? Is that based on something?
Well, it represents a misunderstanding of the more recent literature. There has been a historic bias in favor of using transfusion, and it was based on numbers. If you came into the hospital when I was a resident or a young physician, and your hemoglobin was below 10 and your hematocrit was below 30, well, by God, you could be sitting there conversing animatedly with your family, and by God, you were going to get 2 units of red cells.
Right.
During the 1990s and 1980s, it became clear that transfusion was causing more problems in many patients than it was helping. Could we use another number? And the answer came through loud and clear. If you use the number of 7 and 21, you might actually do better.
Yeah.
And certainly you didn't do any worse. Should we be using numbers as the primary indication? No, don't use the number. The number helps tell you what the trajectory of the anemia or platelet count or whatever is, but it doesn't constitute an indication for transfusion. And there's reason to suspect that there isn't a number that we can use beyond which everybody does better than they would without transfusion. What I would say as a hematologist, it's based on what's the cause of the anemia? What's the likely trajectory in the future of the disease causing the anemia? What are the patient's current signs and symptoms of anemia? What other options are available that may be more effective and or less toxic?